Somewhere it gets stuck. It doesn't want to fully extend or bend the leg. This can be uncomfortable. It might pull too much. First stage, second stage, third stage. Our goal is not Olympic heights. Endure a little, work through it, and you'll feel immediate relief. Hello everyone, friends. As always, we meet here on the Healthy Movement channel. My name is Maxim Mamchur. I am a physical therapist and I am also the co-founder of the Healthy Movement Kinesiotherapy Center network. And today we will talk about a rather common topic, knee osteoarthritis. We will cover the first stage, the second stage, and the third stage of knee osteoarthritis, and importantly, how to deal with this condition. Specifically, we'll explore how to walk normally again, how to completely get rid of pain, and how to prevent surgery, all from the comfort of your own home. You can perform these beneficial exercises right now in your own home without requiring any equipment. So please stay tuned to the channel and get yourselves ready because we are about to begin doing some gymnastics together. And I sincerely hope that after this session, your knees will indeed thank you. Let's get started. Knee osteoarthritis. What is it? Look, we have two surfaces in our knee joint. One surface, the other surface. The knees end up looking like this when the nutrition in the knee has been poor for a long time, and this nutrition improves or worsens depending on the work of the muscle pumps, meaning the muscles act like pumps, like little engines pumping blood and fluid into the area, and accordingly, friction inside is reduced. It's like pouring oil into a car. To keep our engine from wearing out, we add oil. It's exactly the same here. If the muscles work well, they improve nutrition, increase the amount of synovial fluid, and as a result, the joint moves smoothly and doesn't wear out. When, over time, our muscles become weaker, or when we have some functional imbalances, for example, if the pelvis is slightly tilted somewhere, or if we have scoliosis, then, accordingly, the load on one part of our body becomes greater. For example, the muscles on this leg are working. They work worse, so they don't pump blood as well, they don't supply as much fluid to this knee, and as a result, the load on this knee increases, which leads to the development of arthrosis. The first stage is when we start to feel some pain or discomfort, and maybe some of you have already gone to see a doctor. The second stage is when we start to experience stiffness in the joint itself. We feel sharp pain, constant pain, we get an MRI, and can even see that there are changes in the meniscus, maybe even irritation of the ligaments and so on. And the third stage is when the knee even gets stuck at times. It doesn't want to fully extend or bend. This is already the third stage, panikomiri, and at that point, doctors usually refer us for surgery, for joint replacement, and so on. Today, we will talk about what exactly to do, what specific kind of exercises can truly help you at least live a normal, comfortable life, even with osteoarthritis, move around more comfortably, and completely forget about the persistent pain in your joint. Please don't switch away. Follow along closely with me, and be sure to write to me at the very end about what you truly felt after doing these beneficial exercises, because I am more than confident that I know precisely which exercises these should be, how they effectively help, and I know how to significantly improve your overall condition by increasing the amount of vital synovial fluid in your joint. So, friends, the first exercise. We will work on a large group of muscles, the quadriceps, the front part of our thigh. When the quadriceps pumps blood through itself, our knee becomes maximally saturated with synovial fluid. That's the first point. Second, the quadriceps is large, and it accordingly stabilizes the knee and helps to relieve the load from it. What do I need for this? I need a roller. I place a roller like this under my knee, you see? If you don't have a special roller, you can simply roll up a towel and place it under your knee in the same way. Or for example, a pillow. Or for instance, in an extreme case, you can place a large bottle of water under your knee. This is how it lies. Ready? Let's start working. What am I doing? I simply lift my leg and straighten it. This is how it is. Time. I took a day off. With an exhale, 2. Weekend, 3. It's a small movement, small, but it involves the quadriceps and works the knee. Further, 4. Relax. 5. Relax. 6. Weekend. 7. And 8. And number 9 and number 10. Let's count now. Together we go. One more time. Let's do it again. And 10 more workers. Time. 2. And with an exhale. The medicine will relieve pain even if it hurts to straighten your leg. 4. And 5. And 6. And 7. And 8. And 9. And 10. 20 times. If 20 times is too much for you, you can do it 10 times. For the next workout, do it 15 times. In the following workout, do it 20 times. It's very important, friends, after this exercise to feel warmth in this area. So what do we have? 10 or 15 or 20 times. We do 3 sets. That will be about 15 or 20, depending on your physical ability. It could be 10 for you, 20 for someone else, and so on. So always choose what truly works best for you. But remember this one main thing. With each subsequent session, we should aim to add at least 1, 2, or even 3 more repetitions to our regular routine. These additions can be made every other day, for example. Let's move on to the next exercise. We'll also work on the quadriceps, but this will be a stronger, higher quality workout. The next exercise, I will sit comfortably on the very edge of my bed or alternatively on the edge of a sturdy chair. I also place a roller underneath and perform a wider range of motion exercise for the quadriceps. What do? First, I straighten my leg as much as I can. Then return to the starting position. Exhale. 2, 3, 4, 5. I can truly feel my knee getting noticeably warmer. The entire quadriceps area is becoming significantly more warmed up now. I'm really feeling the heat building up. We are now counting 7, followed by 8, then 9, and finally 10. After completing those, we will proceed with another full set of 10 repetitions. Let's begin. 1, 2. You can follow along with me right now. 3, 4, 5. 5. And while I am carefully explaining the theory to you, you can certainly do the exact same thing now, just on the other leg as well. Even if the other leg isn't bothering you, it's truly important to continue with the exercise. Count out loud. 8, 9, 10. Finished? We typically do this exercise for either 10, 15, or even 20 repetitions, depending entirely on your current physical condition. 3 sets. For example, the first set is 10 times, the second set is 10 times, and the third set is 10 times. The rest between sets can be 1, 2, or 3 minutes, so that you feel you've recovered and can continue. For everyone, this can be individual. We're not in a hurry. Our goal is not Olympic heights, our goal is different. The main thing is to get the blood flowing through our joint and to strengthen our muscles, which will act as stabilizers and shock absorbers for our joint. And now the third exercise, we will work on the back of our posterior thigh and accordingly get the blood flowing along the entire back of our leg as a whole in order to significantly improve the nourishment of the knee from behind. We then carefully lie down on the bed with our knee positioned below the edge of the bed. That is, you can see that my knee is no longer resting on the bed, but is hanging below the edge of the bed. What am I doing? Simply lying down, I bend my leg at the knee. 1, back to the starting position. My leg is really hanging down. With an exhale, 2. Count 3, then 4, followed by 5, then 6. Continue to breathe deeply and steadily as you reach 7, then 8, and 9. It is crucial to keep breathing throughout this exercise, maintaining a consistent rhythm. Now focus on your breath as you count to 10. 1. Allow your body to relax with each exhalation, ensuring each count is accompanied by a full breath. Don't just drop your leg down like that. 2. Release it gently, supporting it. 3. With an exhale. 4. With an exhale. 5. And we have the number 6, and then the number 7, and then the number 8, and finally the number 9. And one more time. 10. Finished. Next exercise. After thoroughly pumping the back of our thigh, we will then gently stretch it a little to significantly improve muscle elasticity and make it even stronger. This is to effectively increase the crucial throughput function of our muscles, the vital ability to let blood flow through, so that it reaches the knee joint as much as absolutely possible and substantially increases the amount of synovial fluid. So we carefully sit down, the leg is perfectly straight, and of course, if it doesn't quite work, it can be slightly bent. I simply lean my torso towards the knee like this. In doing so, I feel a really good stretch along the entire back of my thigh. 1 and 2, as you gently exhale. This might feel a little uncomfortable. It might pull just a bit too much, but it will also significantly improve the overall condition of your front side as well. So endure a little, keep working, and you'll feel immediate relief. 4, 5, and 6. Be sure to slowly and completely exhale. Exhaling deeply and fully truly helps us to stretch much more effectively and thoroughly. 7, 8, 9, 10, and 10 more repetitions. If that is not enough for you to feel the burn, you can simply switch legs and continue with the exercise if 10 repetitions are sufficient for your current fitness level and provide an adequate challenge. Let's begin by counting the numbers. 12. Then we proceed to 13, followed by 14. Next we have 15, and finally we reach 16. After completing this sequence, we will count 4 additional numbers, all while performing a slow and controlled exhale. Now let's count these 4. 1, then 2, next 3, and finally 4. Okay, that's just enough. Friends, this is very important. While doing this routine I'm showing you, make sure to drink water throughout. For a routine like this, the average person should drink at least 1 liter of water. But this doesn't mean you just sit down and chug it all at once. It means that after each set of exercises, You take a sip or two of water, another sit, then another sip or two of water. Why do we need this? It's necessary for the synovial fluid, which will fill our joints. But if we just chug it all at once, the water will simply pass right through us and out. You know what I mean? But if we keep sipping water regularly, thanks to the continuous work of our muscles, it will go exactly to those specific areas we're actively pumping with these muscles. That's why water is such an important element. And now the fifth exercise, the most important one, without which honestly none of this really counts, and it's better not to do any of it without the fifth exercise. What do I mean by that? I mean, we need to apply a cold compress to our knee. Yes, specifically a cold compress. And many of you might say, how can it be a cold compress? I have inflammation there, I have arthrosis, it swells up. And yet you're telling me to use a cold compress. Look, here's what happens when I apply cold. First of all, thanks to the exercises I mentioned earlier, we've pumped as much fluid as possible into the area. So what have we done? We've pushed out the old fluid and filled it with as much fresh, new fluid as possible. But since there's inflammation there, the body needs to keep that fluid in place to help retain it and promote recovery so that the inflammation can subside. But for us, again, to speed up our recovery, we need to bring in new fluid there once more. So what are we going to do then? I take something cold, a compress. I can generally do this over my pants. If, for example, you were wearing shorts, you can use some light fabric. I apply it to the knee for 10 to 15 seconds. It's very important not to put it directly on the skin, but through some kind of very light fabric. What's truly happening to us? All our vital ducts, all our intricate channels, all our, let's say, essential vessels constrict. They effectively close off the crucial flow to the knee and as a direct result, pump fluid right out of our knee. Mind? Hold it here for just 15 seconds, then move a little bit lower. 15 seconds. Next, hold it under the knee for 10 to 15 seconds. A little lower than the knee. 10 to 15 seconds. I've closed off all our vessels, so the fluid has been expelled. Next, the body understands. There was the local cold effect. So what needs to be done? You need to warm up this area. And once again, it sends new, fresh fluid there. And in this particular way, by consistently changing these vital fluids, by sending new, fresh fluid there each time, the entire process of regeneration and recovery significantly speeds up. And in this way, tomorrow the knee won't swell up like this, and as a result, it won't hurt tomorrow. And in this way, we speed up the recovery process. So, don't be afraid of the cold. 10 to 15 seconds on one spot is fine for your knee. My dear ones, I genuinely hope you missed me, and I indeed hope you enjoyed this knee routine. If so, please let me know in the comments. By the way, it makes me really happy when you recognize me, come up to me, and share your experiences. How you exercised, how you did the exercises online, how you trained with us at the centers. So don't be shy. Let me know about yourselves and share your stories. I'm truly interested, and it really makes me happy, honestly. And that inspires me to record more and more new ones. And again, to make new videos and work even harder for you. So I hope for your likes, subscriptions, comments, and see you next time.